Now, as the battle against COVID-19 rages on, the University of Pretoria has turned to technology to help improve the treatment of ICU patients. Stevie, the mobile robot, will play a vital role in ensuring this. The gender-neutral robot will help allow communication between IC specialists across the world. Stevie, who's been named after anti-apartheid activist Stephen Bantu Biko, is deployed at the Steve Biko Academic Hospital. For more on this, I'm joined by Professor Fathima Paruk from the University of Pretoria to tell us more about this. Prof, tell us how Stevie, the mobile robot, is actually supposed to help with care in our intensive care units.
Good morning, Ms. Ehud, and thank you for having me on your show today. So Stevie really is a product of a global collaboration during the COVID pandemic, and it involves the University of Pretoria, the Steve Biko Academic Hospital, the Charité University in Berlin, and the Richard Koch Institute. And Stevie is really, has already been put to work in our institution, and I'm excited to say that already we can see that the level of ward rounds and the level of the actual care of our patients is absolutely has been enhanced. Largely because what happens is that we have an intensive care specialist team from abroad and our intensive care team joining together virtually at one ward round together, and essentially we have discussions around the patient, we raise pertinent issues that are relevant to the management, we share ideas, and as a result there's robust discussion, debate, and this results in enhancing not only the management of our patients, but also improving the knowledge base of our trainees who attend the ward round, and this obviously also impacts on future management care.
Now, of course, I know that Stevie is also supposed to basically make the world seem smaller by making sure that international doctors also come into the ICU unit at the Steve Biko Hospital. So talk about the fourth industrial revolution. How's the communication between your doctors at Steve Biko and Germany as the chosen country to start this out first, and why Germany?
So essentially, the reason we have chosen Germany is because Germany has a very good track record in terms of telemedicine. This particular team has been involved in outreach for the last 3 to 4 years, and so they actually are quite they have the necessary expertise in terms of telemedicine. So it's always good to collaborate with an institution that is already has experience from that perspective. The issue about Stevie is not just a quick fix for COVID. The reality is that telemedicine has a huge role to play for critical care in South Africa. So we really see Stevie as a proof of concept. The critical care services in our country are extremely fragile if we look at the public and the private sector. From the private, the reason why we have a very fragile critical care service in our country is because we have an extreme shortage of intensivists. We only have about 100 intensivists in our country, and the vast majority of them are based in the public sector. So most of our ICUs in the private also do not have an intensivist to run the ICU. The second shortage you and the rest of the country is really aware of is the extreme shortage of beds. Now, if we have this kind of expertise rolled out long term and in the future in our country, we can really solve potential problems such as ad hoc consultations to specialists who don't have ICU experience, both in the public and private sector. And the other advantage would be we could reach out to our peripheral hospitals, the ComServe doctor who doesn't know whether the patient needs ICU or how does he optimize the patient prior to transfer. So Stevie really is to garner evidence to show that we can implement change and better use resources in our country to try and enhance the effectiveness of critical care in our country.
I've run out of time, Prof, but very quickly, is there any plans to extend Stevie, maybe make more Stevies for other hospitals as well, including even the private sector, because as you said, we're battling there in our country?
Absolutely. So, to implement change, we need evidence, and that is what Stevie is all about. We're going to garner evidence to show that in the long term, we can roll out this to both the public and the private sector to enhance care in our country.